we're saying about if a nerve gets tugged or twisted in some place in the body, it can affect all the way up to the brain, and vice versa. So this particular meningeal torsion or twisting is very significant in the reason why we can get results with this technique that other techniques don't necessarily get to. So if you have all this extra stimulation going on in your body, then you're going to get really tired. You're going to get brain fog. So sometimes the brain fog comes because things are twisted and you're being yanked on all the time. And fibromyalgia is also related to that as well. I'm not going to open this one up, but we do have it shows the brain stem going in here too with a little blood flow and everything. I've got a video on the internet you can watch if you want to see. So trauma to any nerve in the body, whether in the hand or foot, can cause a pulling the disc coating called the meninges. Does that make sense? This saran wrap stuff. The pulling itself can cause the nerves not to function. The tension can also cause a restriction in the flow of cerebral spinal fluid, which is brain spinal fluid. The brain is surrounded by a fluid as well as the spinal cord. If it's twisted, then it can't flow properly. Nutrients, immunological components, neurotransmitters are all part of the cerebral spinal fluid. If you have a spinal tap, like you're trying to test to see if you have meningitis, then they have to go through the meninges to get to the fluid and to suck some out to test it. So that's what a spinal tap is. We also have blood flowing through that area. So I'm going to go through very briefly the actual anatomy of the meninges so you know as much about this as a neurosurgeon. I'll give you a little certificate today as a junior neurosurgeon that you passed the test. So the cerebral spinal fluid provides brain and nerves with nutrients, and a block in the flow can cause severe neurological problems.
Did you say this is online? Like you just?
Yeah, my little discussion here. I have two YouTube videos that talk about meninges.
So like the thing that we just saw that information's online.
Like these, using these little pictures.
That what just went away or something.
This I haven't ever recorded this whole lecture before, but I'm doing it now, so it'll be on the internet.
Oh, good. Okay.
Yeah. So here's the skin on the top of your head. Next we have the periosteum. That's the surrounding of the bone. After that we have the bone itself is porous there. Then we have the three layers of the meninges. The dura mater, the arachnoid, and pia mater. Dura mater is very tough. The arachnoid is porous, sort of like cobwebs. That's why it's called arachnoid, related to spider. And then pia mater is thinner. That's the part that is directly against the brain tissues, the nerves of the brain, against the spinal cord, and against the nerve roots. This is a cross-section through the center of your brain. Down the center of the two hemispheres there is a crevice. And so here, each of these meninges all go down all the way. And you can see here, this is the arachnoid, this area here, and then the pia mater is even closer in, and the dura is here. So you see, this is where there is the accumulation of both blood and cerebral spinal fluid. So in short, on the outside of the dura mater, then we have predominantly blood flow. That's both arterial and venous. It's going into the brain and out of the brain. That's part of the blood-brain barrier. Then we have the arachnoid. Then we have the cerebral spinal fluid circulation. And then the pia mater, which is next to the tissues. Now, direct trauma from auto accidents and falls can cause damage to the nerves, and which slowly over time can cause severe malfunction of your body, just like going down the stairway and hitting your head, or falling on railroad tracks and almost paralyzing yourself if miraculously you're walking. So all these different factors can lead to a block in the flow of cerebral spinal fluid and cause pulling on, covering of the nerves. So these are problems that can be relieved with this new breakthrough technology. For example, neurologic pressure on the spinal cord can trigger pain nerves and make you ache all over. So we have different kinds of nerves. We have sensory nerves, and we have pain nerves, and we have motor nerves. Sensory nerves are the nerves that are in the skin and other parts of the body that pick up things like pinprick. There's special nerves that are just for pinprick. There's special nerves for large pressure. There's special nerves for light pressure. Or like if you use a cotton ball. So if you go to a neurologist or somebody, they use like a little pinwheel, and then they use like a cotton ball, and they may take some ice and put that on an area. Because we have different nerves for different kinds of senses. We have heat ones, we have cold ones. So there are a lot of, that's sensory nerves. The next one are pain nerves. That's sort of related to the sensory nerves, but we also have other nerves that are related to pain. Then we have motor nerves. Motor means muscle movement. So there are nerves that go from the brain or from the spinal cord out to the muscle, say contract and relax. So those are the different types of nerves. And so pressure on the spinal cord can trigger pain nerves and make you ache all over. It can also make your body do wrong things at the wrong time. So if you go in and somebody does a tapping here on the nerve here, it's testing to see if you can actually get a sensation going out the arm, and they create a jerking motion. So that's an example of a neurologic test that we do just to see if the nerve is working properly. However, certain nerves, if you stimulate them, they'll cause the release of adrenaline in your body. Adrenaline wakes you up. So you might be getting adrenaline surges when you want to sleep. That's no good. Or you may be getting signals to the stomach to suppress the stomach's operation when you actually want it to be digesting food. These types of stimulation of the nerves that are errant, E-R-R-A-N-T, which means ones you don't necessarily want, out of mind. They can also give you phantom pain in your neck, back, feet, or hands. So you may not actually have something going on in the hand or the feet or somewhere, but you're having this nerve stimulated, and you think there's pain there. Neurologic pressure can overload your brain with so many signals you can't think clearly. That's brain fog. It's like when I was tugging on you in different directions, Bill, like it was your grandkids or something. It's that kind of too much stimulation going in, overwhelming. You know, and women tend to have more receptors for serotonin than men do. They have like 7 times more. So that's why they can multitask it. Right? So one, if you give her like 12 different things to do, that's overwhelming. 7 she can handle. A guy, 2. You give us 3, 4 things to do, we're a mess. It's brain overload. All right, that's a joke, but not total. So neurologic pressure can overload your brain with so many signals you can't think clearly. And it can even change your brain chemicals and hormones, causing you to feel anxious or depressed. So even basic senses may become altered, causing changes in vision, hearing, taste, smell, or speech. Now you remember that video that I showed initially with the woman who had the hip pain. She said like a couple weeks later that all of a sudden she was walking around her house and realized she could smell things again after 20 years. It was because her olfactory nerve, related to cranial nerves, got released. All of a sudden it was functioning again because we released the torquing and the twisting and the meninges which had cut off function.